welcome to Leaders of Tomorrow, your one-stop platform for anything to do with the entrepreneurial world. I'm Sunanda Jayaseelan. On the show tonight, we are talking about the learnings from the first and the second wave of the pandemic, and also looking forward to the likely third wave and what is going to be the impact if we are to see one, and how can we as citizens and how can we as entrepreneurs and as individuals really come together to ensure that the impact, if any, is minimal of this possible third wave. All of that being decoded on today's panel with our panelists. We're also going to be going into a report that FICCI and EY have done jointly, titled Prevent, Plan and Prepare, Strategies to Win Against the Pandemic, and the key highlights of that report. Gentlemen, thank you so much for taking the time to join us here on the Leaders of Tomorrow, talking about, of course, what's happening around us as far as the pandemic is concerned, talking about the impact across India, across the people of India, and also on the businesses that have seen an impact. Let me start today's conversation first and foremost by coming to you, Mr. Panda, and asking you to talk about the key highlights, or the key perhaps one or two takeaways that you have in partnership with EY at FICCI. Of course, you've done the survey that is analyzing the impact. Just one or two key highlights that you would want to kick off today's panel discussion with for our viewers.
Sunanda, first of all, thank you for having me on the show. FICCI set up the COVID task force early on in April, before really the second wave had gathered momentum. And the idea was that we bring together experts from across the spectrum in the healthcare sector, be it hospitals, be it path labs, be it other service providers, etc., to try and get their, harness their knowledge and look at what policy interventions that we could suggest to the government, and of course also help out our members. And the approach all along is what the report is titled, which is Prevent, Plan and Prepare for Future Waves. Ideally, of course, one would like to prevent it. And in that perspective, the concept was that to look at the data of the first two waves and see if there is any learnings in there for us. What is interesting, and of course the other panelists will get into it in greater detail. What is interesting is that while at the national level, when you see there are two distinct waves, but if you drill down further into the data, there is actually nothing homogeneous about the data, which could help us predict when and how the third wave or any future waves would pan out. And therefore, the conclusion one draws from that is that it's very important to have localized preparedness plans rather than have a one-size-fits-all sort of an approach. And secondly, something which we have seen in practice, the importance of vaccinations, carrying through with that. We have done very well in that regard, but continue that momentum, as well as, it is critical for the general population to follow COVID appropriate behavior in order to ensure that, we don't have a third wave. It at best is a third ripple, if I can put it that way.
Absolutely, very well put. And the government, of course, has announced that it has this massive target to hit in terms of vaccinations by the end of the year. And in fact, I was reading that they're planning door-to-door vaccinations. That's going to be a huge task, but a commendable one at that, and definitely much needed. Subhrakant set the ball rolling in terms of talking about the past two waves that we've seen and the likely third wave. And my question is to you, Kaivaan, next. And if you could, really talk about data and the impact that we've seen of the past two waves, and that perhaps will give us some sense, or will that give us a sense of predicting really what could likely be the impact if we were to see this third wave or this third ripple, like Subhrakant was saying?
Sure. Thanks, Sunanda. I think while recently, global data is very much indicating that severe cases and hospitalization rates have come down in the last few months. I think given the erratic nature of the virus, right, which lends itself to new escape mutations and precedence of multiple waves globally, I think it is imperative that the country's policymakers, providers, and public continue to maintain a laser-like focus, as Mr. Panda mentioned, on preventing, planning and preparing for any sudden surge in incidents. When we analyzed wave 2, and at its peak, which was sometime early May, what really came out was that India needed 8 to 10 lakh beds, which is nearly 60% of our total bed capacity, to cater to moderate and severe COVID cases. And obviously, we all know the kind of stress our bed capacities were during that peak. The issue was further accentuated by the inequity in bed distribution across states, regions, and districts, and possible shortages in over 200 districts, right? So I think given the experience of the learning that we've had from the previous wave, I think it is very, very important that we have a specific response to cater to moderate cases, especially when there is a surge capacity, to manage peak load situations, because interestingly, the peak load situations are temporary, but also tempestuous in their manifestation, right? And which is why there needs to be a very, very focused strategy. And that's where the concept of COVID intermediate care centers, has been proposed as one of the fulcrum recommendations of this paper. And Dr. Joshi will allude more around the concept and its importance.
Sure. So Dr. Joshi, Subhrakant made a very important point that, while at the national level, we're talking about two waves, when you look at what's happening at the micro level, perhaps, there's just so much more in terms of how many waves or how many ripples we're looking at. And if you're talking then about taking a very localized approach when it comes to tackling the infection, what is your recommendation? What is your suggestion? And it's an interesting data point, and just for our viewers, for those who are closely tracking the numbers, Karnataka, where I'm joining this panel from, for instance, only about 40% of the total adult population which is eligible to take the vaccination has taken it, which means that there's just so much more of a distance to go. What is your recommendation?
So, Sunanda, I think every disaster, more or less, when you reflect back, brings you back to the basics of disaster management. And the fundamental of any successful disaster response is it is as good as your last mile response in any disaster. So while we talk of, as Mr. Panda mentioned, national response, the bed capacity of Bangalore is very different from what it would be in a town like Mandya, right? The resource infrastructure is completely different, but the virus doesn't discriminate that, right? The virus is going to hit with the same ferocity. What we really need to understand on ground is, do we have at least up-to-date basic idea about what is the infrastructure if the virus hits tomorrow? What are the resources that are there? What is the current capacity which is occupied? What will be my surge capacity from the existing infrastructure and people? And what if a level 1, level 2, or level 3 incremental surge happens? How is this system going to cope up and respond? And towards this, we are in a way fortunate. This is an illness which doesn't let people die in a day or two. Infectious diseases will give you a certain time of at least week or 10 days before people turn severe. So you have about 80-85% of people who stay as mild or moderate, while all our attention and focus usually goes upon those who are dying. So if we can actually look at the larger problem of 80-85% of mild and moderate cases, and there are last mile response on handling mild and moderate cases effectively on the ground, and then using the existing already short-staffed or under-capacity healthcare infrastructure appropriately only for the ones who deserve to be coming to the hospital, we would have done a far larger justice to a larger population at a lesser cost and in a much more timely response. As always is the story, retrospective analysis of data and disaster is far more convenient, but by and large, country as a whole has done a phenomenal job. The reflection is to make it better next time.
Absolutely, and a very, very important point that you've raised. You were talking about the last mile, and this is open to the entire panel, but perhaps I could come to you on this first, Subhrakant. The role of the government perhaps is most crucial when it comes to the last mile, more so in healthcare. Do you think we have, as part of our learnings, do you think there has been enough learnings also, not just on the part of industry and the public, but also the role of the government really when it comes to our preparedness for this possible third wave?
Well, let me put it this way. When the pandemic first hit, I don't think anyone anywhere in the world had an idea how to respond to it, what to expect of it. It's no surprise that India, along with everybody else, was taken by surprise. But I think the response, the learning has been quite good. And the one example that I think is worth repeating is our approach to setting up distributed oxygen capacity, because the oxygen shortfall that one saw in the second wave was not a question of availability. It was a question of logistics, because there was plenty of oxygen available in Eastern India, which is where the steel production capacity is concentrated. The difficulty was in transporting that to the north and the west and wherever else it was needed. And the amount of work which has been done in putting up all these oxygen plants at various districts, at various large hospitals, I think this in itself is a significant learning that we have had. Secondly, I think now the task force is, and here I'm referring to the government, is now very much alert to the possibility of new variants, and how to ensure that there is enough data which is gathered, so that we are alert to the possibility of a particularly severe variant. And I think these are the ways in which I think the learning has been good. And of course, starting from an initial situation again where there was, it took a little bit of time to scale up vaccine production. Today, you are at a situation where we are, I think, 12 to 30 crore doses per month being produced, and that will go up even further when other vaccines like the J&J vaccine and others start getting produced. And all of this, I think, is a result of focused sort of attention. Yes, initially there was, everybody was taken by surprise. I reiterate. But I think we have done well to pick up the pieces from there. And the final point I want to touch upon is vaccination. 110 crore doses is no mean feat. We're talking about 1/5 of the world's population effectively in terms of the number of coverage. The important thing here, of course, is that if I have my data right, that about 25% of the population in India is fully vaccinated, and about a further 50% have had a single dose. So what is important is to, of course, go through and complete, second dose for everyone. And that is where I really urge each and everyone, as has been reiterated by no less than the Prime Minister himself, that, there is no room for vaccine hesitancy. There is no room to let our guard down, thinking that, oh, we are down to 10,000 cases and it doesn't matter if I don't get vaccinated or I don't take the second dose. There is absolutely no room for that. I want to touch upon one aspect here. There's a very interesting thing known as the exponential growth bias, because everything around us, every measurement that we look at is linear by nature. This is a business-oriented show. When we talk about quarterly growth, you're talking about a linear growth, how a company did compared to a quarter before or a year before or whatever it is. But exponential growth is not something the human mind is sort of tuned to understand. And what we have to keep in mind is that we have done very well as a country to be down to 10,000 cases or thereabouts, but let your guard down. And this is something which can rapidly get out of control. I'm sure that won't happen, because I think everyone everywhere is keeping an eye out. But I just wanted to stress upon that fact, the aspect of not having an exponential growth bias.
Gentlemen, I'll take a quick break. We're back in just a moment. Welcome back. You're with us here on Leaders of Tomorrow. Speaking of learnings, Kaivaan, this question is to you. What are some of the global best practices and the models that we can perhaps look at? The rate at which we here in India are opening up, our economy, everything is very different from what is happening in other countries. But that being said, is there something that we can perhaps learn from some of our peers?
I think each country, interestingly, is exhibiting its own diverse learning, and I'll give I'll answer a question with 2 or 3 examples, Sunanda. Let's take an example of Indonesia, right? They've seen mortality in pediatric COVID patients almost 3x or 4x of global average, and that's a result. And people are attributing to the fact that their child immunization program is weak, malnutrition, and these are ills which even ail the Indian healthcare system. I think one is very important to really protect our pediatric population. I think that's one, and each of the state governments is drawing up plans to ensure that we have the right number of PICUs to address any unforeseen or unfortunate surge on the pediatric side. Coming to now, if I take the example of UK, interestingly, between the peak of wave 2 and wave 3, there's possibly been only a 20% reduction in incidence. So at its peak, UK was roughly around 998 new cases per million population in its second wave, which came down to around 798 in the third wave. So 20% reduction in incidence. But very importantly, an 85% reduction in hospitalization, and again, an 80% plus reduction in mortality, right? And a large part of this is attributed to the vaccine coverage that we've seen.
So, Dr. Joshi, if I can come back to you, and you were talking about preventive healthcare amongst other things, and saying that we should also focus on the population that's likely, could perhaps fall sick. What, according to you, should the learnings be, not just to the entrepreneurs that we talk to here on the Leaders of Tomorrow, but for anyone who is watching? What should our learnings be? What should our takeaways be from the first and the second wave, so that we ensure if there's this third wave, we as a population are better prepared?
I think the first point important is that we have to accept that there is a problem ahead of us. The first part of an epidemic or a disaster is that we accept that it is happening. A lot of countries lost a significant time in accepting and mounting their best response first. That's the first aspect of the story. Yeah. Secondly, know your risk factors beforehand. If you are going to be in any kind of situation like this, what is the age group? What are the underlying comorbid conditions, etc. that are there? But Sunanda, beyond this, because you're talking about industry, I think this opens up a very important facet that what came out very clearly during this epidemic was we were a very hospital-centric healthcare infrastructure. Yeah. And for a lot of entrepreneurs, this has opened up a lot of opportunity to see on how parallel or complementary systems of healthcare delivery they could create, which could complement the existing hospital system to either reduce the input onto the hospital system of mild or moderate cases, or early transition. The ones that have been hospitalized for severe condition, could we transition them to avenues like transition care center or home health care, or for that matter, PHCs, etc. How could we repurpose some of the existing infrastructure to mount the response during such an epidemic?
Yeah, absolutely. And that is an interesting point, and I want to take that forward with Subhrakant. We've spoken about the learnings for the public. We've spoken about what perhaps has been the learnings on the part of the government as well. And I want to talk about industry at this point. Do you think that industry has responded, fast enough really to the opportunities, if I can call it that have been posed for businesses from the pandemic? Do you think the healthcare industry, do you think there's been enough investment going into these businesses? And if not, just doing some, crystal ball gazing, if I can call it that, about the 2 or 3 areas where you think there is a lot of scope for innovation in the healthcare space, and you would like and advise entrepreneurs to really look at this?
Well, the healthcare industry, along with every other aspect of the economy, was initially taken by surprise, was perhaps overwhelmed a little bit. But I have to commend, the frontline workers, the doctors, the medical personnel, everybody else, for the spirited effort that has gone into into protecting the rest of us, often at great personal risk to themselves. So first, I think that's it's a debt of gratitude that we owe to all of them. Now, in terms of the opportunities for the healthcare sector, I mean, look at it this way: there has been a significant upsurge in the healthcare sector allocation, and that is something that is good good for the country, because all the economic aspirations that we have are on one side, but I think the basic fundamental for any country to be a leader is to have is to be able to take care of its population. I think it is correct to accept that there were some shortcomings in the healthcare sector in terms of our ability to respond to pandemics and all that. But again, the flip side of that is, if something like this happens, had happened 100 years earlier, I mean, who knew what was coming and how to prepare for it? But I think there is a huge opportunity ahead in terms of the increased allocation by the center and the states to the healthcare sector. And as Dr. Joshi put it, there is a lot of innovation, which is going into it. First and foremost, let's look at it as mRNA vaccines. I mean, we all know that, going back to previous, not just the pandemic, but any other, illnesses, it probably took upwards of 7-8 years, maybe a decade to come up with a proper vaccine. But this time around, thanks to the new, the mRNA technology, the fact that we have been able to come out with a vaccine, which is very effective, and that too within a year, I think is a huge thing. Now, that's, of course, a big ticket item. And I know that mRNA vaccines are being developed indigenously as well. But I think if you drill down deeper into the sector, there are several ways. I'm not an expert, so I don't think I can comment on what really are the opportunities. But there clearly is an opportunity in terms of improving healthcare, in terms of improving access to healthcare. And don't forget that the facilities that we are creating to deal with the pandemic is not purpose specific. It can also help us deal with other topical seasonal illnesses. There is a dengue issue going on in Delhi and elsewhere at the moment. The basic principles of it are broadly the same. So I think there's a lot of positives that will come out of this at great cost, but there are positives that will come out of this.
All right, gentlemen, thank you so much for taking the time to join us here on the show. Completely out of time on tonight's episode. If you have any feedback for us, do let us know. Our contact details are on your screens as we speak. Thank you for watching. Have a good night.